According to the University of Washington Medical Center's website, there are about 8,000 new cases of testicular cancer each year in the U.S., with approximately 400 deaths. Testicular cancer is the most common cancer in men ages 20 to 34. We spoke with Dr. Daniel Lin of the Urology Center at the UW Medical Center about testicular cancer.
The most common sign of testicular cancer is a testicular mass. It's the most common sign of early testis cancer. Unfortunately, some men, a lot of men seem to ignore it. There's one thing that's a problem, is that some men seem to say, oh, that's going to go away. And when they're waiting for it to go away, it's spreading. Another issue that sometimes arises is that sometimes men seek out help for a testicular mass, and it's found that the doctor that sees them thinks it's an infection, and they give them antibiotics, again, waiting for it to go away, but it never is not an infection, it's a cancer, and then it spreads during the time they're treating it with antibiotics. But the single most common sign is a testicular mass.
Testicular cancer is the most curable cancer if it is caught early.
Testis cancer is probably the single most curative cancer known to man, except for maybe some skin cancers. All right. It is exquisitely sensitive to chemotherapy. Some forms of testis cancer are sensitive and very responsive to radiation as well. And also surgery always plays a role. So it's sort of the poster child for oncology in that there's surgery involved, there's chemotherapy involved, and sometimes there's radiation, and they all work very well. And it's very important to have them all in concert with each other, so together with each other in some way.
Unfortunately, there is no clear cause for testicular cancer.
We know smoking causes lung cancer. Smoking causes, or in large part, can cause bladder cancer, stomach cancer. Smoking does a lot, obviously. Some infections can cause cancers. Hepatitis, infectious hepatitis can cause liver cancer. We know some of these links are fairly clear. Human papillomavirus can cause cervical cancer. We know some of these cause effects. We don't know X causes testis cancer. We don't know what that is yet. But there's a lot of research being done in that field. Hopefully we'll know soon. But we do know men that are born with their testicle, one or both testicles, not descended. Yeah. So they're not all the way down their scrotum. We do know that those men are at higher risk for getting testis cancer. But not all men that have that get it. It's just that's the single highest risk factor for later developing testis cancer, is if they're born with their testicle not quite descended. So those men are at higher risk, and they probably should be counseled by their pediatrician or somebody that you ought to check maybe a little more frequently.
Over the last 15 to 20 years, major advancements have been made in treating testicular cancer.
And mostly those advances have been in chemotherapy, treating advanced testis cancer. Because as recently as really 20, maybe 30 years ago, testis cancer that had already spread was basically a failed diagnosis. Maybe 70 or 80% of those men died. Whereas now, even testis cancer that's spread, even distantly spread from the testis all the way up to the lung, is curable sometimes as high as 80 or 90% of the time.
According to Dr. Lin, young men are not told about testicular cancer as much as women are told about breast cancer.
Young men, I think they have to be aware that this is the single biggest cancer in their age group. They have to just check themselves after a shower once a month. It doesn't take that much. I think that's important to understand, and to recognize that it's very curable, and not to ignore it if they feel something strange, to seek out opinions.